The toxic work environment that we experience because of hate, which probably has nothing to do with us personally, but more to do with the way that doctors are dismissed in the media or portrayed in the media, the way that we take for granted the sacrifices that people make to be in a position to help others with their medical conditions. That creates a tension that is palpable. So much so that a fourth-year medical student is writing an op-ed about it before she's even gone into residency.
Welcome to UpMed, a journal of healthcare's race to the bottom, hosted by Dr. Erica Urquhart. Join Dr. Erica and her guests as they pull back the curtain and share a behind-the-scenes look at the healthcare industry, all while providing solutions for better patient care and management. Now, here's your host, Dr. Erica.
Hello, and welcome to another chapter of UpMed, the journal of healthcare's race to the bottom. I'm your host, Dr. Erica Rowe Urquhart, and today we're going to just delve a bit into what exactly constitutes a toxic work environment, specifically when we're talking about being in healthcare and a healthcare provider. I recently read an op-ed which was entitled, "I Don't Like Doctors." It was written by a fourth-year medical student, and I'd just like to read an excerpt. She says, "When I share that I'm going into medicine, I often get the response, 'I don't like doctors.' Initially, I would become defensive, knowing I have 8+ years of school and time dedicated to learning medicine. It is discouraging to have your profession dismissed, knowing you so eagerly entered it to help people. Most of us pursuing medicine gave up relationships, vacations, time with friends, and other life experiences to pursue a career serving patients." She also says, "I can feel personal response when someone says they automatically dislike or distrust you based on your degree. It requires great patience and humility to take a moment and listen to someone expressing these thoughts and try to encourage them to give their physician a chance to help them." The reason why I opened this chapter with this excerpt is this actually happens to be a female. This young future physician is writing from the perspective of what many would call the apex of her medical school experience. She has mastered pathology, and then she has gone further to do her clinical rotations in medicine, general surgery, ophthalmology, psychiatry, emergency medicine. If you can think of all of the core elements of being a doctor, she's done rotations in that. She's likely passed the first part of her board experience, where she's now able to do even more, knowing that she's preparing for the second part of her board experience. So we're talking about someone who is educated, experienced, and has the prescience to be able to assess what is evolving into an adversarial relationship with those whom she has dedicated her life to serve. And so, if that doesn't define a toxic work environment, what does? I think it's so easy to say, "I don't like doctors." But the reality is, when you enter a pandemic like COVID-19 and you refuse to wear a mask because someone who doesn't have a medical degree told you that it's safe to go around without one in the middle of that pandemic, And then by chance you actually get the disease, which before we had the vaccine had no treatment, you expect a doctor to help save your life. Whether or not you wore a mask is not going to be a question that is asked when you present to the emergency room in severe distress because you are exposed to a deadly disease in the middle of a pandemic. And yet, that's exactly what happened. In 2020 and 2021, and even now, there are individuals who contract life threatening diseases. And some of those diseases are of their own making, be it if one is a smoker, an overeater, you name it. There are sequelae to every decision, consequences to every decision that one makes. And then these individuals present to us, to healthcare providers, and they expect us to treat them, to care for them. Never mind that that day or the day before or 2 weeks before, they proclaim that they don't like doctors. When it comes to the bottom line, when the pedal hits the metal, doctors quite often are what stand between patients and death. Patience and the sequela of the decisions they make, patience and a better quality of life. And I'm not saying that to say that I have a God complex. I'm just saying that the toxic work environment that we experience because of hate, which probably has nothing to do with us personally, but more to do with the way that doctors are dismissed in the media or portrayed in the media, the way that we take for granted the sacrifices that people make to be in a position to help others with their medical conditions, that creates a tension that is palpable. So much so that a fourth year medical student is writing an op med about it before she's even gone into residency. So we're evolving this conversation. And one of the reasons that the chapters of this podcast are organized in the way that they are is because I want the listeners on this program to really understand that doctors, healthcare professionals are people, and that most of the people that engage in this journey, as the medical student mentioned, she listed it, right? We sacrifice relationships. Why? Because it's a 24/7 type of profession, and even to learn how to do it well, you do have to eat, drink, sleep, medicine. You give up vacations. You get 4 weeks of vacation a year. You give up time with friends. You're always at work. Your friends are at work. If you have friends outside of work, you probably don't see them very much. And they have to be understanding of the fact that you're just not going to be around. And other experiences that individuals in other professions take for granted, that we in medicine made a decision to sacrifice so that we could actually do what we do well. And in order to do that, in order to learn that massive amount of information and to be able to make decisions in the heat of the moment that are based upon science and experience and the specifics of the patient that you're taking care of, in order to be able to do all of that, there's a certain amount of sacrifice that's involved to do it in the time frame that our medical education system requires. And so it's so hard to look back at specifically the COVID-19 pandemic and think about all of the doctors who lost their lives because they stood firm to their commitment to care for people, even in the midst of a life threatening circumstance and situation. And then, on the other hand, read that a medical student feels the pressure of the doctor hate. I don't like doctors. The guests on our podcast have been very candid in describing the challenges, the opportunities, the joys of serving their patients and practicing medicine. But when you're faced with the social pariahism of being a physician in combination with the financial duress of the repression of reimbursements and the fact that there are non-medical people making the decision about the worth of the work that we do, not based on any standard, any national standard, but rather on the idiosyncratic efforts that are made to gain profit by the payers, the insurance companies, from the work that we, the healthcare providers, are doing. When we look at that squeeze, the financial pressure, and then the psychological pressure, and then the adversarial nature of talking to and working with patients day in and day out, we're finding that physicians are either burning out or they're checking out. And it's because it's a toxic work environment and it's a self fulfilling prophecy. If you don't like doctors, then you are going to turn off doctors that like you, and you're going to get more doctors that are not of the ilk that would encourage and engender respect, admiration, and general positive feelings. It's a self fulfilling prophecy. If we don't compensate our doctors, and if we don't respect and esteem those who have dedicated their lives to serving others, we will continue to observe that race of healthcare to the very bottom. On that note, I welcome you to join us for another episode of UpMed, the Journal of Healthcare's Race to the Bottom, where we'll talk with some valuable professionals who have great wisdom and insight as to what's happening in their specialties in medicine. Thank you so much. I'm your host, Dr. Erica Rowe Urquhart.
Thank you for listening to this episode of UpMed. For more information on Dr. Erica, visit her website at upmed.us and her LinkedIn profile at Erica Rowe Urquhart. To continue the conversation, visit and subscribe to our YouTube channel at E. Rowe Urquhart. And don't forget to hit the follow button on your favorite listening platform so you never miss an episode. We look forward to joining you next time on UpMed, a Journal of Healthcare's Race to the Bottom.